Hello, and thank you for clicking on the Nervous System Disorders lecture. Um, on the screen here, we see two very famous people that both suffer from a neurological disorder. One of which is, can you name them on the left there? Sometimes students can, sometimes they can't. On the left is Muhammad Ali, and on the right is Michael J. Fox. So, Michael J. Fox was an actor. You guys may have seen him in Back to the Future. He was Marty McFly, and a really great actor, a really great man. And one of the reasons I bring this up is because diseases and issues get money when celebrities end up being affected by them somehow. And then there is a lot of money raised for different causes. And both of these gentlemen have raised a huge amount of money for a disease that's going to affect the nuclei in the brain. Now, we haven't really talked about these nucleuses. They call them nucleuses, and they're not a nucleus like you think of with your cells, but they are a different type of nucleus. So you have one here that's in red. You have another one over here that's like in peach color, like a sandy, I don't know what that is, and then a lighter peach color. Okay, so these are different nuclei of your brain, and sure enough, when you have a disease like Parkinson's, as it's called, you end up having damage to the brainstem. It's in the midbrain where you have the damage. So this picture right here is showing us the midbrain. So the midbrain is the center section here. Remember, it's the section above the pons. Here's the medulla oblongata. Of course, this is the cerebrum. We have our olfactory bulbs. We have our cerebellum. All right. So you guys should be familiar with these regions of the brain now. So the midbrain in Parkinson's has a difference. We notice a difference. So in a normal person, there is something called substantia nigra, and it's a dark region in the midbrain. And sure enough, we need that, whatever's in there. I am not schooled on this. I am sure that there is much more information out there on Parkinson's disease, but I just know that it comes from this region of the brain. And this region of the brain is lightened in Parkinson's disease, meaning the color's not there. So there's something in a normal brain that is missing from the brains of those people that have Parkinson's disease. Okay? Now, I want you guys to understand that these different things are responsible for doing different things, all right? And this little cerebral nuclei here is responsible for supporting movement of your muscles in your torso and in your shoulders, all right? We have this little one here is responsible for making sure that you have the right amount of dopamine in your brain. Remember, dopamine is a neurotransmitter. Okay, now the neurotransmitter dopamine in this case is actually an inhibitor. So we have signals coming from our brain all of the time, and sometimes we use neurotransmitters to stop that transmission. Very confusing, I understand, but just know that what happens in Parkinson's disease is that your body does not control this motor neurons signals to control movement, and therefore people with Parkinson's shake. All right, so Michael J. Fox has said in interviews, if you look him up on YouTube, he talks about the fact that when he engages his brain in other activities, the shaking stops. So he was born in the Northeast, or he lived in the Northeast as a child, and he said he really enjoys ice skating because when he's out on the ice and he's skating, his Parkinson's, his shaking stops. So very interesting how the brain works. Again, Parkinson's is one of the disorders, the first disorder that we are going to include in our notes there, okay? So it is a deficiency in the neurotransmitter dopamine in the midbrain, and it causes shaking. Another thing that causes shaking is epilepsy. Epilepsy is going to be sudden bursts of irregular electrical activity in the brain. And hopefully you understand the charges, polarization, depolarization. Epilepsy, for whatever reason, those neurons just send action potentials. And doctors have a good grip on what causes epilepsy, and we have good treatments to treat epilepsy. Now, there are some more, derogatory, that's not the right word. There are some more severe types of epilepsy that are not completely controlled, but we do have a good handle on the epilepsy that affects most people, okay? So, epilepsy is the second most common disorder suffered by human beings. And sure enough, sometimes people have epilepsy and don't even know it, because when we look at the different regions of the brain, when we think about the different regions of the brain, if you had an epileptic seizure in the visual center of your brain, you might see things. If you had epilepsy in your auditory center where you hear things, you might hear things, all right? If you have epilepsy in your motor region of your brain, this is where we're going to end up having convulsions, where people actually shake. And it's really important that you all know that if somebody has a seizure, you want to try to protect them, make sure they don't get hurt. So if they have a motor region seizure and they do end up convulsing, they most likely will end up on the floor. It would be really important to try to protect their head. Medical science says do not try to intervene in any way other than protect them. One common thing that used to be believed was put something in their mouth. And I'm telling you now, do not put anything in anybody's mouth, all right? So, believe it or not, doctors find it easier to sew your tongue back together than it is to remove whatever it is that you've chewed and embedded into your throat and into your cheeks and so forth by putting something in somebody's mouth. So that is a myth, that you want to put something in somebody's mouth when they have epilepsy. Sometimes people, if they're having an epileptic seizure, they'll vomit. You can roll somebody onto their side in order to clear their airway if needed. All right. The other thing I want you guys to all understand is stroke. And stroke is really, really something that we should pay attention to, because stroke is the fifth leading cause of death for Americans and the number one cause for disability in Americans. So if you have a stroke, we're better at saving people. So we've dropped to the fifth cause of death, the fifth most common cause of death, but it is the number one cause of disability. So once somebody has a stroke and we take them to the hospital and we save them, they most likely are going to have some sort of disability. All right. So a stroke is going to be when you lack oxygen to those brain cells. And sure enough, there's some different things that you can notice in stroke. There's an acronym, which I don't know it, but you want to look for lateral movements being equal on somebody. So if you thought somebody was having a stroke, you would want them to talk to you. If they can talk normally, they probably aren't having a stroke. If they're having trouble talking, you ask them to smile. And when they smile, do both cheeks move? Do both sides of their mouth engage in the smile? If it's only one side, that is definite sign of a stroke and that person needs medical attention, okay? The other thing they say is have the person reach their hands up over their head, right, to raise both hands at the same time. If one arm won't go up or won't go up as well as the other, those are indications that somebody is having a stroke. All right. So you want to get them medical attention as soon as possible. Again, we have good treatments for treating people with stroke. And if you think you're having a stroke, the sooner you make it to the emergency room, the better off you are, because then they will be able to treat you before your brain spends more time with lack of oxygen. Okay. Now you should know that you can increase your risk of stroke. You can increase your risk of stroke if you have high blood pressure. Okay, high blood pressure is often caused by being overweight. It can also be caused by heredity, meaning you just get it from your parents and you need to take medication. If you smoke, it doesn't matter what you smoke, smoking will increase your blood pressure. And then also if you have diabetes, your increase of stroke goes up, or your probability of having a stroke goes up. So super important that we make sure to, take care of our bodies, make sure that we are as healthy as possible, all right? So interestingly enough, this picture represents a number of people through history. Up here in the top left, I have Julius Caesar. They believe Julius Caesar suffered from from epilepsy. Van Gogh here, we believe was an epileptic. Napoleon Bonaparte, the leader of France, we believe was epileptic. All right. We also have the Mona Lisa painted here, and the Mona Lisa was painted by Da Vinci. Da Vinci, this right here is Peter the Great, and this was carved by the great artist Michelangelo. And all of these people were considered to have epilepsy. So epilepsy is something that's been around for a long time. I apologize that I put that out of order with my little notes there that I had. This right here is the graphic that goes along with stroke. So an embolism is a blood clot. When you have a cranial embolism or a brain embolism, that's also a blood clot. And all of the tissue downstream from where that clot happens would get lack of blood supply, causing a big problem. The next thing that has been plaguing, there's what it looks like if you had a stroke in a CT scan. All of the area that's black there is area that has died from lack of oxygen. So if you look, there's a motor region and sensory region that might cause paralysis. It might cause numbness. You definitely want to try to keep all of your brain whole. Okay, so this right here is two brains. One of them's healthy, one of them's not. Hopefully you can pick out the healthy one. So the one on the right is the healthy one, and the one on the left is a brain that was removed from an Alzheimer's patient. 4 million Americans have Alzheimer's right now. The statistics say that if you reach 85, you have a 50-50 chance of having Alzheimer's. So this is something that affects millions of Americans. It's super, super important that we spend some time trying to figure out Alzheimer's. And we've done a great amount of research, and we have figured out that in Alzheimer's, you have neurofibrillary tangles and plaque. So in the center of the screen here, this red stuff is a plaque. And then inside the neuron, we have fibrous tangles where that message is supposed to go down the axon. We're finding it doesn't. And we're finding that the plaque that builds up around the axon is also causing problems. Okay, so what kinds of problems do they cause? They cause dementia. Dementia is just a confusion, not understanding time and place. There's lots of memory loss. People are very disoriented. People can have hallucinations. So Alzheimer's, unfortunately, runs in my family. Both of my grandmothers had Alzheimer's at the end of their life, and that made life very difficult for me and the rest of my family. Something that my dad participates in the UCI Mind Study, which is a clinical trial that's trying to figure out what is going on with people that have Alzheimer's, so that way we can try to prevent it. And you guys saw that the shrunken brain, the brain started to lose its neurons, and sure enough, we're looking into why it is that the brain is whittling away in Alzheimer's. Okay, the other thing that I want you to understand is multiple sclerosis. In multiple sclerosis, the myelin is destroyed. And when your myelin is destroyed, we end up with a number of issues. You have vision and memory impairment, there's loss of balance, slurred speech, bladder dysfunction, loss of sexual sensation, and trouble walking are just some of the symptoms. These are the most common symptoms. This graphic shows that there is no treatment, no cure, and that is still true. There are drugs and therapies available that will make things better. Okay, so about 2 million people globally have multiple sclerosis. It happens twice as often to women as men. And if you have a Northern European ancestry, you are more likely to get it. So that would be me as a white folk. So if you are Latina or Latino, then you have less of a chance of getting multiple sclerosis. Again, we don't find it in your genes. All right. So there's nothing you can do to make this worse. There's nothing you can do that will cause you to get multiple sclerosis. No known cure. And very, very, very sad for the people that it affects debilitatingly, meaning causing disabilities. All right. And then the last thing I wanted you guys to write down was about encephalitis. Encephalitis was what the picture of that child with the inflated head was. Encephalitis is a swelling in the brain. Like I said in the other video, that child would need medical treatment for sure, but because the sutures had not formed in the skull yet, meaning the bones are still not connected, there's room there for that expansion. But once you're an adult, when you start getting brain swelling, well, then you have a problem inside your meninges, and that can be caused by a bacteria or a virus. And when your meninges are stressed, you can increase that pressure enough to cause brain damage. So there are a number of signs that you might have meningitis or encephalitis, all right? And those would include a severe headache, a stiff neck, really bright lights are very, very troublesome. You can have a fever and vomit. You can be drowsy, less responsive, vacant meaning somebody tries to talk to you and you're just not there. And sometimes you can get a rash, and it can happen anywhere on your body. It doesn't happen exactly where your infection is, because your infection is inside your brain or spinal meninges. Okay. You guys are around babies quite often, so I did want you guys to know that babies and toddlers can get meningitis as well. We have to look for different symptoms in them. One of the things that is a real telltale sign is this weird back arching. Now, I have to say, my kids used to throw fits all the time, like when I tried to put them in their car seats, and they would arch their back, and that's a different thing. So if a baby has some of these, it doesn't mean they have meningitis, but it's definitely something that you should keep an eye on. Aside from the pale, blotchy skin, pretty much everything on here are things that babies do on a regular basis, especially that high pitched cry. But I will tell you that when a kid has meningitis, their high pitched cry has a different sound. The arching of the back is different. All right. So pay attention. If you think that you have some sort of issue, you would definitely want to contact your doctor. Super important. Okay, I do want you guys to know that that is just a list of some of the things that can affect people neurologically. It is not comprehensive by any means. Some common questions that I get are about headaches. Headaches are not fully understood. Doctors are still trying to figure out what causes headaches and how. What about brain freeze? Brain freeze is very interesting to study because we don't have a lot of information about it. It's a wide, broad category, neurology, and it is so big that the people that are neurologists aren't even neurosurgeons, and neurosurgeons aren't even neurologists. And we don't have time to cover everything. So those are some of the few things that cause problems in our American population. And the nervous system is very interesting. Okay, well, thanks for watching, and I will catch you again.